Hello, welcome back to the channel. This is Gifty here. We're going to wait for a few people to join the live. Today we're going to be discussing the physical changes you're going to be seeing or experiencing during your pregnancy. So, there will be a lot of changes in your body when you become pregnant, right from the beginning to the end. And of course, following the delivery as well, you're going to have some changes. Most of these changes will revert back, some not so much. So if you have any questions as I talk through, please ask your questions. But we're going to be discussing physical changes that you're going to experience during your pregnancy. I've got some notes down here, so if you see me looking down, it's because I'm looking at my notes to make sure that I cover everything. Okay, so I'm going to get into the video now. So basically, when you are pregnant, of course, you are excited, you are most of the time, you are planning the pregnancy, or you are looking forward to becoming pregnant. Once you become pregnant, every pregnancy is different, first of all. So no two pregnancies are ever the same. So each one is different. It comes with its own physical changes, mental changes, emotional changes. But in all, the majority, I guess, win the vote. But in all, I'm just going to go through a general physical things that you might experience. You may experience some and not all, or some people may say I've experienced it all. But it's okay, whichever one that you experience, as long as your pregnancy is going well and you are healthy, your baby's healthy, then there's nothing much to worry about. You just have to ride it out. At the end of the day, it's only 9 months, so it's not forever. The first thing that you're going to experience for your pregnancy, majority of people will experience this, and that is nausea. So nausea may involve you actually throwing up, or just the feeling of feeling sick. Okay, you may not exactly throw up at all, but you may feel like you want to be sick. Okay, and this is absolutely normal. It's fine. Some people get excited by this feeling because they think it means that they are really pregnant, and they feel like, yep, this is a good sign of pregnancy. And in most cases, it really is. And you will feel nauseous, and it's okay. It will pass depending on your body and your pregnancy. Along with the nausea, the other thing that you're going to experience is a really, really good sense of smell. Okay, so you're going to really be smelling everything in sight. Sometimes you can smell something that others cannot smell, and you're going to be telling them, oh, can you smell this? Can you smell that? And people are going to be like, what are you talking about? Oh, I can't smell anything. And you can really smell it. And this is why sometimes you may smell something that will make you feel nauseous or sick. So it goes hand in hand that if you are having this strong urge of sense of smell, you will also have some form of nausea or sense of feeling sick, because not every scent will be conducive to your stomach. So this is very, very normal. And if you're feeling this, it's absolutely fine. Okay, so write it out. Again, this will be early pregnancy signs. Sometimes you may not even have tested yet and got a positive test, so you might be feeling and thinking, oh, why am I feeling sick? Why have I got such a good sense of smell? Or if you've never been pregnant before, you put it down to maybe something that you've eaten, or somebody smells around you, or something like that. Okay, most of the time you have a lot of smells regarding foods. So some foods that you normally would like, you smell it and it will make you feel nauseous, or some foods that you smell, you normally don't like it, and you suddenly feel like, oh, I really want to try that, or I really want to eat that. And that will move on to your food cravings, and the sense of wanting something really, really badly, where sometimes you don't even have access to it, but you just know, I would like to eat it, and you want to eat it now. This is all part of the early pregnancy signs, and these are the things that you're going to feel and see changes in your body of. Okay, moving on to the more physical things in terms of what you're going to experience in your body. You may start to feel like your breasts are becoming really tender, especially some pain in the nipple area, really sensitive, as in to a point where when you wear a bra, you will feel really, really sore. So you might not want to wear a bra sometimes, or if your partner was to touch you, or to even play about, then you may feel like, oh, this is really sore, don't do that, don't touch it, or you may not even be able to touch it yourself. This is all very normal and common. And it is a good sign of pregnancy, although not very particularly nice. There's not much you can do about it. You can't take a pain relief for it to go. It does get settled later on as you get more and more pregnant. This feeling will be accompanied by larger breasts. So your breasts will start to get larger and you feel like, oh, it'll be quite exciting actually for most people. They'll feel like, okay, my breasts are getting bigger. Maybe you've always wanted a bigger boob and now you're getting one. So you might be really, really excited about the fact that your breasts are getting bigger. But it does come with some discomfort. In some cases, a really, really sensitive pain is what that you'll be experiencing. Again, this is normal. Another thing that you'll be experiencing this early stage of your pregnancy is that you'll be feeling like lack of appetite as well. Sometimes you feel like you cannot eat, or everything that you think about that you think you want to eat, but when you suddenly get it in front of you, you don't have the urge or the appetite to actually consume the food. And this is okay, this is normal. And depending on how well you are doing with this is where you're going to lose some weight or you're going to gain some weight or come in. So in the early stages of pregnancy, some women will lose weight normally because of one, the food aversion where they don't feel like eating it, or number two, you're feeling nauseous. So therefore you're constantly feeling sick. So you don't even want to think about food, let alone eat it. So you start to lose some weight. At this point, most women will know that they are pregnant, whether it's around about the 4-week mark, 5 weeks, 6-week mark. And this is where you're going to be experiencing this. Now, when it comes to your body changes, apart from the breast getting bigger or feeling sore, the next change that you're going to see is increased discharge, okay? You're going to start to really feel like you're getting more and more increased discharge, almost to a point where you're thinking, oh my goodness, like, you're making a lot of mess. You may have to start using some panty liners, and you may have to use a pad, or you may have to visit the bathroom more frequently than you normally are used to. And this is absolutely normal, okay? So if you are experiencing this, just know that it is normal. Your body will start to produce a lot more hormones that is going to try and build what we call the mucus plug. And this mucus plug is what's going to block the way in order for your baby to stay safe. So nothing can get to the uterus or to baby to do any kind of infection or anything like that, okay? So this is very, very normal. What you can do to help is make sure that you're drinking plenty of water and you are making sure that you're passing urine regularly and consistently. In terms of even passing urine, you are also going to have increased urination, okay? So your body is going to start to secrete more urine, even when you haven't drank much water. Sometimes you go to pass urine and you are not getting a lot from yourself, or you're drinking lots and lots of water and you're passing way more than you think you are drinking. This is absolutely normal, and it is a good change in the body because you want your bladder to be filtering your body, getting rid of toxins and things like that. And then also, if you are feeling like you're passing urine, don't ever feel like then therefore you don't want to drink water, okay? It's very, very normal for you to be drinking water. And then as a result of drinking or needing to pee often, you're going to be using toilets that are not, your own, or outside of your house, outside of areas where you're not normally using. So please be mindful and be careful that you are wiping very well. You're wiping not, from back to front, you're wiping from front to back so that you don't introduce any infection to the vaginal area and therefore result into any urine infections. So make sure that you are, doing a good self-hygiene, and you are taking care where you are going to use the bathroom that is sanitary, safe, and you are not picking up any bacteria. But make sure that you do not hold your urine. You are definitely going to the toilet when you need to go, okay? In terms of, passing urine and all of that kind of area in the vaginal area, you are going to start to get more hormones and your blood volume will start to increase. Sensitivity is going to get more, and then you're going to be feeling like, you may feel like you have a higher libido, or you are having less libido than usual and what you're used to. Again, this is very, very normal. Explore this with your partner, or if you are single, then just know that this is quite normal as well. So it's nothing to worry about. So low libido or higher libido is absolutely normal as well during your pregnancy. When you are feeling like you are having issues with going to toilet a lot and all of that, like I said, that is all normal. In terms of your movements, in terms of your bowel movements and going to the toilet to pass urine a lot, you are also then going to start having a lot more slower movement in your bowels. So you're not going to be passing and going to toilet as usual as you normally would. When you're pregnant, your hormone that you produces, there's a lot of hormones that your body's doing. There's a lot happening in your body. And one hormone that is responsible to you to be able to give birth at the end is a relaxant hormone. Okay, this is what is going to help your soft tissues and ligaments and some muscles to loosen up in order for your baby to grow, especially from the uterus, from being down below in your pelvic rim to come up to your abdominal cavity. So these hormones will help to relax your tissues and things like that. So therefore, your body can grow this baby and the uterus can move upwards from where it's normally at to the top of the, your abdomen wall. This hormone will also make your intestinal functions very, very relaxed. So therefore, your bowels are not going to be moving as quickly as they normally would. So you're going to become constipated. You're more likely to be more constipated than you are to be more looser. Okay, so constipation is a big deal in pregnancy. So to help you with that, you want to try and stick to more fibrous foods. You want to try and break up your food times. Okay, so don't eat like a full plate of food. You want to try and break down your meals and eat smaller portions but more consistently. So you're eating regularly, but you're having less amounts in your plates. So make sure that you're not consuming lots and lots of food in one go, because you're going to be feeling really, really bloated. Really, really, it can also add to your nausea. But eating lightly, eating smaller portions, and eating frequently can help with nausea. It can help with constipation, and of course, making sure that you're watching what you are eating is also very, very important. So make sure you're eating healthy as much as you can, and you're also drinking lots and lots of water to help you hydrate and also to help your bowel movements to go a little bit faster than what you would do. But constipation is one thing that your body is going to experience, and this is very, very normal. Okay, if you're feeling like you're really constipated, there are some medications that your doctor can give you. So do see your doctor if you are feeling constipated, and they can help you with some medications that are safe in pregnancy. Don't worry about it not being safe. They'll always make sure that you are being given medications that is safe for your baby as well, as long as they know you're pregnant. So make sure you tell them, you explain your symptoms, and then they'll give you the right medication based on your history as well, and if any allergies that you may have. Another thing that your body's going to change too is that emotionally, you are going to have some changes in your brain, in the body, in your moods. It's very common for you to feel really teary sometimes. You may even cry sometimes for no apparent reason. You may see an advert of a cat, like jumping over their bowl, and you start to cry in emotional breakdown and think, oh my God, the cat is so cute. Oh, what is it doing? I hope it's got food. It sounds really silly, but you are going to feel it to your core. Like, it's so sad, or is really emotionally challenging for you. And this is very normal. People around you may think, oh my God, what are you doing? Like, why are you crying? Like, it doesn't make sense to them, but it makes absolutely sense to you. And if people are not understanding you, you might move quickly from crying to being upset and, telling them off and saying, why are you not understanding me? Stop being silly. I'm not stupid. You blow things out of proportion most of the time, and they're just looking at you like, what is going on? What did I do wrong? And they just don't get it. But again, this is very, very normal. Like I said, your body's producing so many hormones, so much that your body's doing, that things can be a little bit out of sync, and it may not be like how you normally are. It will pass. So just hang in there. And if you are a partner watching me, just support your partner and just, give us some reassurance and just keep giving her some TLC, and this will help her to get through the emotional aspect of all these changes that's happening in her body. Also, what you need to look out for is that you are going to feel a little bit vulnerable. Okay, there are things that will be going on in your body that you may not even perhaps understand it yourself, and you may feel like you don't want to discuss it because you're thinking it might sound silly, or somebody who think you're being stupid or it's nothing to worry about. But if there is something bothering you, it's always important that you do talk it out, okay? If you are a person that has a history of any mental health, such as you normally suffer with anxiety, you suffer with depression, you may be on medication for depression or anxiety, you may have had a history of, emotional unwellness where you've had some sort of inpatient treatments or anything like this. This is a big area for women like yourself, and it's nothing for you to be worried about. It's very important that you recognize it, that you are aware, you make your health professionals be aware of your history if they don't know, and they can support you better. You are, at risk of maybe getting more emotional or a little bit more extreme than others without that history. So it is important that you let your health professionals know so that they can support you. And maybe the threshold of what we would expect from somebody without this history might be a little bit lowered for you in your case. So, like I said, each pregnancy is different. You may experience this in one pregnancy and nothing in another, or nothing in your first pregnancy, and your subsequent pregnancy, you may feel like, you are feeling emotionally unwell, and you will feel it yourself. So please do give yourself some TLC as well. And if you're feeling anything at all that you feel, you recognize it to feeling like you've had before, or you feel like your anxiety is coming up again, or you feel like your stress levels are increasing, you're not sure how to deal with it, then please do seek help and support, because this is very, very normal. Like I said, you have a lot of hormones going on, your brain is changing, and your body is changing. There's a lot to deal with. And depending on whether or not you have support, this can also affect you in many ways. When it comes to the brain, one thing that you have to also be aware of is changes in your memory. So you may feel like, or you may have heard it before, where people say, oh, I've got baby brain. This is absolutely a thing, okay? Your brain does change. You will be very, very forgetful. You may feel like, oh my God, I don't remember anything nowadays. If I go into a room to get something, I'll come out and I'm not sure what I went in there for. Or you might see somebody that you absolutely know for years and years and years, and all of a sudden you can't remember their name. You're standing in front of them, you're looking at them, and you can't remember their name. And you're thinking, oh my God, I can't believe, but I don't know your name. I can't remember your. And you feel like you're being so silly, and it'll be so funny to some people sometimes, but it's absolutely correct. It is baby brain. This effect will last for some time. And even after you've had the baby, you'll feel like, oh, my baby brain is still going on. It's still not come back to itself. And you're still experiencing this memory loss, forgetfulness, and feeling like you're not with it most of the time. You're feeling like a bit of like, oh my God, I don't know what's going on. I can't remember anything these days. And most of the time you say, if I haven't written it down, I'm not going to do it. So what you can do to help is to write things down. Don't worry, this is not a permanent thing. Your brain will get back to its usual self. But write things down, especially when you have questions for your doctor, your midwife, the nurse practitioner, whoever you're going to see. If you don't write it down, when you get in front of them, you're going to be given a lot of information all the time in every appointment. You are never going to remember to ask the right questions. And then as soon as you've left your appointment, you're now thinking, oh my goodness, I've just remembered my question. So I always advise and tell my patients to get a notebook that they can use to write down questions. They can use to, jot down some answers to the questions when we do give them. Sometimes you may go to your appointment without your partner and they may have some questions. Write the questions down and get the answers for them. So it will help them to feel involved and help them to feel like they're in there with you. When they can't go, they don't feel like they're missing out on anything as well, because, life still continues in various ways. So please make sure you have a notebook to help you write down your questions and help you to remember things that are important. Okay, so memory loss, baby brain is absolutely a thing, and it is normal. Okay, one thing that we do not talk about a lot, which I feel like we should do more of, is one massive change. In fact, two massive change that you will definitely experience in most cases. Sometimes you go throughout your whole pregnancy, you've not had this, and then right at the end you get it. This is called piles. Okay, so you're going to have this extra pieces of it's like from the anus, where you have sometimes it's just a little bit of bumps, extra skin, something like this, which can be quite painful during your pregnancy. It's very common, but it's not spoken about a lot. So if you one day go to the toilet to go on, to pass stools, and you find like, oh, am I bleeding? If you realize, oh, is it coming from the back passage? And then you may be wiping, you may feel some bumps or a lump or some piece of skin. You're not sure what it is, but it's painful. Sometimes it can be very painful that when you sit, it's very uncomfortable, or it's very painful to sit in certain times of your trimesters. These are piles. You can get some creams over the counter for this. You can also get some prescriptions from your doctor to help you with this. And of course, it does get better. In most cases, it will go following the delivery. But sometimes it can get worse during your labor, especially if you're having a vaginal birth and you're pushing. With the effect of pushing, the anus does dilate as well. So whatever you have there can be a little bit exacerbated. So it could get worse. So please do mention this to your doctor if you are experiencing any piles at all. And it is very, very common, it's very normal, and it's nothing to be afraid of, but it is an uncomfortable thing to experience. And it's also quite, you may feel a bit embarrassed about it to talk about, or you may feel like, oh my God, am I the only one experiencing this? But if you have a team or a group of friends that are pregnant or have had babies before, you can simply just ask them and say, did you experience this? And you find that majority of them would say yes, they did experience it. And then they can give you some reassurances and tell you what they did, if they did anything different to help it to go. And you will find that, okay, I'm not alone, it's going to be all right, and it's okay, let's get on with what's more at hand, such as getting through your pregnancy and getting to labor time. Another thing that you will experience that we don't talk about a lot, and it can be quite a shock when women do see this at some point during your pregnancy. But with the increased hormones and increased blood flow to the vaginal area, and the fact that you have to pass a baby or give birth to a baby, the average size of a baby could be between 2.5 as a normal size baby for full term, up to 3.5 kilos. So you're going to have a baby, and therefore the vagina itself, okay, will change. It will change dramatically. Some people are very, very shocked when they see their vagina change. And when I say change, I mean it's going to get bigger, okay? It's going to get much, much bigger than what you are used to. And this can be quite a shock. You're not going to be feeling any different. You're not going to see any different unless you had a look, you took a mirror, you stood with one leg on top of a bathtub and put a mirror down there and had a look. So in your ending of your second trimester to the beginning of your third trimester, your vaginal size is going to become at least a good 2 to 3 sizes bigger. And you're going to feel like, oh my God, if it's the first time you're looking or the first time you're looking and seeing it big, it is going to be a shock. Okay, if your partner is one that is happy to have a look often, or he's been looking often, he will be able to tell you, or they will be able to tell you and say, oh, it looks like it's getting bigger, or it's looking different, or and you may feel like if you took a hand and just felt down below, you will feel like, oh, it feels a bit heavy. Sometimes you will feel like it's a bit heavy, but if you were to look at it, you will know that, okay, it's changing. So if you've never heard of this, please, 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 and you're at the beginning stages of your pregnancy, do take note of this, okay? It is absolutely normal. Nothing is going to happen to your vagina. You can still continue to have intercourse. It's absolutely fine. It doesn't affect baby or yourself, but it's just a lot more bigger, okay? And please, please take note. I'm not stressing. I can only just stress it enough that is going to change dramatically. Very low numbers or very low percentage of women will have their vaginas stay the same or just slightly bigger to a point where it's noticeable but not shocking. But in most cases, it can be shocking. The other thing also to note is that sometimes you can get a varicose vein in the vaginal area. Okay, this can be quite uncomfortable to very, very painful, depending on how big it is, where it is, how often it's been, is irritated, how long you've had it for, and how well it's growing. So varicose veins in the vaginal area or in the inner thigh is very common. You're going to experience this. And if you have never had varicose veins in your life and you do see this, it can be quite shocking it can be quite disheartening or very stressful. It can give you a bit of anxiety, but please speak to your doctor, speak to your midwife. We can reassure you and say this is okay, it's normal, it will go. Especially with the increased blood volume when you are pregnant, this is a vein, so if you're getting more blood volume, it can stress the vein out and make it a lot more bigger than you're used to, or where you've never seen it like that before. And this is normal, okay? And also, of course, when you are pregnant, especially towards the ending of your pregnancy, maybe around from the 35-week, 36-week onwards, you will start to feel like you're feeling a bit puffy. Okay, so you're feeling like your body is going to start to retain more fluid. So you might feel like your lips have become bigger, your nose has become bigger, your face, your cheeks, apart from you actually gaining weight, which is normal again. You feel like some parts of you is quite bigger. Your hands are going to become more bigger, a little bit more swollen, a bit more stiffer in the mornings when you wake up. Your wedding band might become really tight, so you may have to take it off at some point. Your ankles, your feet may swell up, and you feel like you can't wear your normal shoes anymore, or your shoes don't fit you as well. Again, this is very, very normal and it's common. It does go away. The best way to deal with swollen ankles and feet is to try and elevate them. And then when you're trying to elevate them, do it correctly. So make sure that your feet is higher than your waist in whichever position you're seated in. So don't just elevate your legs onto a pillow or onto a chair or a stool. Make sure that your leg is high up enough to make sure that it's above your waist, to help the circulation flow back up and help you to reduce the swelling. Okay. You are also sometimes, depending on with the soft tissue, that the hormone that relaxes your soft tissues and ligaments, like I said in the beginning, you may also experience what we call SPD. This is symphysis pubic dysfunction. So this is because of the hormone increase in your body. You will feel like your pelvic area might be really sore. When you're lying down and you're trying to move in and out of bed, change it from one side to the other, you feel like some pain in the groin area. When you are getting in and out of a car, you feel like you're getting pain again in the groin area. When you're getting out of your bed, you feel a little bit of a pull or a strain or some discomfort in your pelvic area as well. And this is all down to some of your hormones that is going on. So again, these changes are normal in pregnancy, and you will feel like you have to slow down more. Apart from feeling heavier, of course, with pregnancy and the baby getting bigger, you feel heavier. But with the heaviness and this pain in your pelvic girdle area, you feel like you have to be really, really careful how you move your body. So walking slowly and also walking a long distance will aggravate this pain more. So you have to make sure that you're not doing long distance when you get to this point where this pain is really taken over, or you can feel it more. What you can also do to help is that you can get a maternity pregnancy band, which I can put a link to what I mean by that in the video later on when I upload. You can get a maternity belt that is going to be, you can wear it to help lift up the bump and take the weight off your bump off your pelvic area. This will really, really help. Okay. Sorry, just to mention, please, if you are still watching me and you're liking this live, please subscribe to the channel. Give me a like on this video and I'll really appreciate that. Okay. So back to it. If you are experiencing this pain, wearing a maternity belt is going to really give you some support to help lift the weight of the bump over from your pelvic and give you that comfortable and a little bit of a relief from that area. The other thing that you can do as well is that you can see a physiotherapist and they'll be able to give you some exercises to do. I will put some website to help you with some of these exercises in the video later on when I upload it. And this will help you. And also just be aware of what you do that triggers this pain, okay, that discomfort. So if you know that when you're turning over in bed, it makes you get this pain, then please try and get things like, some maternity pillows in your bed to make you more comfortable. Sleep with the pillow in between your legs and make sure that you are well supported on whichever side you are, and take it easy when you are turning over in bed. I know you are asleep and it'll be hard for you to watch what you're doing, but if you have a lot of pillows and things like that, you will be more aware that you are not able to just turn because you have pillows in your way. So you've got to really remember that, okay, let me take my time and turn my body as well. So it's very important that you are mindful of what you're doing. If you do, commute to work, you might think about working from home rather than commuting, because too much walking will aggravate this pain. There isn't any cure for this pain or this discomfort. Even taking paracetamol is not going to help much, because it's a real hormonal muscular type of pain that you're feeling. Okay. And it's a lot of the ligaments and things like that. So it's very hard to use pain relief. And there's a lot of pain relief that you cannot take during pregnancy. So it's going to be very difficult. The only way that this hormone will go or this pain will stop is when the hormones have reduced, and that's after you've given birth. So following your birth, SPD does improve dramatically. Almost immediately, you feel like 90% better. And then it will take some time for your body to adjust as your hormone reduces to get back to your usual pain-free pelvic area, okay? The other thing to also mention in pregnancy is that your posture, as in when you are pregnant, before you're pregnant, your spine is a very, the shape of the spine. When you are pregnant, as your baby gets bigger and moves, the uterus moves from the pelvic brim to the abdominal cavity, your center of gravity is going to change. So your spine will slightly change as well. And of course, your lung capacity is not as much. So you're going to be having to put yourself in different positions to help you breathe better. You're going to have to stand in a different posture, in a different position to get your center of gravity. And also you're going to be doing a lot of, hip thrusting, coming forward a lot more because of the bump. Okay, most of the time when you're standing with a bigger bump, your legs are a little bit more wider opened to help give you some support and balance. Okay, this is very, very normal. And when you are doing and moving things around, remember that your body has changed in this way. So you need to make sure that you're sitting more comfortably. If you're working from home and you're seated at a chair all the time, make sure you have some good support from your feet, your back, and the sides of you, whichever way, your wrist, So make sure you have good support to support yourself for all these changes. Another thing in terms of muscular and hormonal ones is that you're going to have some pains as well, sometimes in your wrists, your fingers, especially your knuckles. Sometimes you can have pains in your knuckles. And again, this is normal. When you get up in the morning, do a little bit of hand exercises just by shaking your hand like this. Okay, doing opening and closing your fist and just shaking before you get out of bed. This will help the circulation to come back in your hands and to help you to feel less discomfort and less pain. There is a lot of changes that will go on. These are some of the things that I can mention for now. And if you have any questions later on, please put it in the comments box below, and I'll be more than happy to, answer it for you. Of course, the biggest change that you're going to have is you are going to grow a baby. Your body is absolutely going to change. Some people will experience some stretch marks. Some may not experience stretch marks. Stretch mark is just your body's, the growth of the baby is stretching your body, and sometimes it can just it's just a tear in the skin wherever you're gaining weight on. So this is why most women will get a lot more stretch marks either on their stomach, on their hips, sometimes on the breast. They may get some on their arms just here because it may be getting bigger than what you are used to. So the weight gain sometimes will bring the skin to stretch and pull apart and cause stretch marks, what we see and call as stretch marks. Okay, and this is also normal. Not everybody's going to experience stretch marks. Not everybody's going to experience the same stretch mark in the same location as the next person. I'm sure you know of this. What you can do to help with, trying to reduce stretch marks is sometimes we say you can help to reduce it by making sure that your skin is well moisturized. Make sure that your stomach is really moisturized. Try not to scratch the stomach, because with the increased, stretching of the stomach, you feel a bit of itchy. Some people say don't scratch that, or try to use, just your palm to just rub the skin rather than your nails to scratch. There's lots of myths around stretch marks and what you can do to do it, to avoid it or to get some. I think it's a lot more to do with, your genes. And if you're going to get stretch marks, you get stretch marks. If you're not going to get stretch marks, you're not going to get stretch marks. But, it's a lot of psychological comfort as well, doing, oiling your stomach and trying to think this is going to help me not to get stretch marks. Sometimes it does give some self-confidence. It does give you a little boost. So even if you were to get one or two, you would think, well, maybe I would have got more if I didn't cream. but you will never know. So each to their own, and whatever you feel comfortable with is what you have to do. Don't ever worry about it. You know, it is your baby at the end of the day that you're growing, and your baby's always going to, you're going to look at your baby and it's going to surpass any changes in your body that you do see. Make sure that, you know, things that you can control, you control, such as what you're eating. You know, sometimes you may be craving really things that you may not be able to eat or are not edible. This is normal. You know, sometimes people crave the smell of things such as you know, they may crave things like the smell of petrol. I know during my own pregnancy for all three of my children, I was craving the smell of washing up liquid. So the things that you wash your plates with, I had a massive craving for the smell of it. So I always have a tub of washing up liquid with me, and it had to be the lemon flavor. So I always have this with me to just keep smelling and smelling and smelling. Of course, I know I can't eat it, but if it was edible, I would have definitely eaten it. And it was so strong that I had to have it. It started from about maybe 16 weeks right until I delivered the babies. So everybody's different, but I know this was my sense of craving for whatever the reason may be. I'm not sure. Some people may crave things like chalk. Some people may crave the smell of petrol. Some people may crave, normal things, maybe like things that like a combination of pickles, onions, you know, really, really crazy things that you think in, in your right mind, you wouldn't eat it, and they're eating it like it's candy. This is absolutely normal, okay? And this, it will go, it will pass when you've had the baby. Some of these cravings do remain, and some will not, some may not, stay. They will all go. But again, this is some of the changes that I can go through right now on this live. If you are if you have any questions after this live is ended, once it's uploaded, you can definitely leave some questions in the comments box, and I'll be more than happy to answer them. If you haven't subscribed to the channel, please, I would appreciate it if you can subscribe to the channel, and it will help me to keep me motivated. I will be doing lives every Friday evening, and I will be bringing you things such as some demonstrations, informations, and I'll also be answering people's questions if I get a lot of it, and I'll be more than happy to answer any of your questions if you have some. Please, thank you so much for joining the live. I hope I'll see you again in the next one. And if you're pregnant, please look out. Make sure that you're feeling your baby's movements all the time. If you're ever concerned, seek some medical advice. And if you are about to give birth or going into labor, then I wish you all the luck in the world. Go through my channel. You may find some very useful videos and information to help you along in any part of your journey. I've got lots and lots of videos to help and teach you along your way. Thank you so much. Hope you have a lovely weekend, and I will see you in the next live. Take care. Bye.